Are you wanting to improve the health of the pelvic floor? This side lying position might be an easier way to start. From your shoulders to your knees, you're in more of a C position or a hook lying position, stacking the rib cage over the pelvis. Place a yoga block or a small ball between your knees. With your feet on the wall, create slight pressure backwards. This should help engage the hamstrings. Your hamstrings help to manage the position of the pelvis. Continue to pair your breathing with your pelvic floor contractions and managing intra-abdominal pressure. Your inhale would allow the air to expand into the pelvic floor and laterally expanding through the trunk. So I should feel my hands expand outward. On the exhale, start the contraction at the pelvic floor. The contraction should rise up through the lower abdominals. It should feel like an elevator sensation. Your obliques will kick in to help drop that rib cage back down and together. But, and as much research shows, soon as females stand up, everything changes. Speed of movement, the ability to absorb force and manage pressure through the trunk while you're upright and moving changes the demand on the pelvic floor. So once you've established a good foundation of how to manage pressure and breathe and tie all that into the pelvic floor, start to train it in an upright position. In this position, I'll push my rib cage back slightly, practicing the same breathing strategies as I did side lying. Then I'll start to incorporate movement. Dorsiflexion of the ankle, so driving the shin forward. Same movement on my toes. Split stance positions. You can also incorporate different speeds, so faster, slower. Pelvic floor issues such as urine incontinence happen as we stand up. If our base of support is smaller, if speed of movement increases, coughing, sneezing, jumping, we have to learn to manage pressure through the trunk and gain your strength and endurance in the pelvic floor in these upright positions. You have to also remember the pelvic floor is like any other muscle. We should consider it in our training, just like everything else. This position for many people is much easier to feel the pelvic floor contraction during their breath. Breathe and inhale and exhale during an anterior tilt, and do the same through a posterior tilt. See what is easier for you to manage. And be aware that there's no contraction that's cheating the movement, meaning are you squeezing your glutes instead? Reminder, consult with a therapist first that specializes in pelvic floor health. But once you've created a strong foundation, include some patterns standing up.